Good morning, everyone. Thank you for being here today. My name is Sarah Harris. I am the Government Affairs and Policy Lead at Manat for Organon. Thank you to Dubai Science Park for having me here today and for Advance Health as well for setting up this session. I'm going to be moderating our panel today. You may know that Advance Health Initiative was established in 2018 between Dubai Science Park, Connect Communications and Synapse Medical Services to bring together the Dubai Science Park community and the wider UAE healthcare ecosystem. So you're joining today the 21st edition of Advance Health, and this is an opportunity for us to collaborate, to innovate and enhance our collective impact on the future of healthcare in the UAE, the region and the globe. I am joined by an eminent group of panelists today. So firstly, Dr. Rola Hamoud, the Chief Medical Executive for Clearmont Medical Centre in Dubai. Please welcome me to the stage, Dr. Rola. Also joined by Mr. David Hadley, the Chief Executive Officer at Mediclinic Middle East. Not for long, please. And last but not least, Mr. Brian De Francesca, the Director of Operations at Hamdan bin Rashid Charity Cancer Hospital. So we have a really interesting conversation today about driving excellence in patient care. And I think that's a really big and broad topic that we can cover from a number of different angles. So to start our conversation, I'd really love to get each of your perspectives on what is meant by excellence in patient care. Is it the delivery of better health outcomes, the improvement of the patient journey experience, or maybe the provision of the latest technology, or something else? Maybe we start with you, Rola, and then David and Brian.
Yeah, thank you for having us today here. Patient excellence is a very big topic, patient care. And actually, we try to divide it into different categories and focus on criteria like efficiency in care, like timely care, providing the best outcomes in a very professional manner, while maintaining patient rights and engaging patients into their care. And of course, measuring those outcomes by clinical indicators and following up on patients. So we aim to have a patient-centered care where the patient is partner with the team of the care and not just a separate party of the care. When we talk about excellence, it's excellence in the delivery, it's excellence in the experience, it's excellence in the clinical outcomes, and it is an evidence-based excellence, which is based on science, which is using the clinical guidelines, designing clinical pathways. So this is how we try to excel. And in order for an institution to do this, we have to have it in the values and in the core strategic goals of the board of an institution.
Thank you. David?
Thank you, and good morning, everybody. Thank you for having us here. Marwan, thanks. This is a wonderful setting, and it's good to be here. I think you've summarized it really well there, Rola. I think the patient experience and the patient outcomes combined is, if you think of patient outcomes, what does the patient want and does he get it? Because sometimes their expectations of what they want versus what perhaps the doctor or the nurse or the hospital think they want is something completely different. I walk into a hospital and they say I need a hip replacement and I won't be able to run for 3 weeks or I won't be able to do any exercise. That's actually not what I want. I want to walk into hospital and walk out the next day and be able to go and carry on playing squash or whatever the case may be. So I think when we focus on patient excellence, it's important that we understand what the individuals want, and then we focus our attentions around that individual, and we try and achieve that through, obviously, science, through using clinical guidelines, through proper clinical governance processes to ensure that we are not doing anything unethical, but that we're doing something that not only fulfills what the patient wants, but also what is necessary from a clinical perspective. And that goes beyond just the clinical needs. Some patients, they're quite happy to come into hospital, have a baby, and lie in the hospital for 5 days. Others want to go home the same day. And so you need to be able to customize whatever you are focused on when it comes to patient experience and patient outcomes to that individual, which is obviously a massive challenge.
Yeah, it's quite broad as well, right? But placing patients at the centre and that focus on value and how you measure it is a big piece. Thank you. Brian?
Thank you, Sarah. Roland, David, thank you. Covered everything, so I don't really have to say anything. Excellence it's one of those words that's kind of tricky, right? It's like love, right? Defining it, defining what excellence is, and it can be somewhat relative. Is excellence in Liberia the same as excellence in Los Angeles? And so sometimes it helps to define something by defining what it's not. Healthcare delivery is still not as safe as it should be. We haven't made much progress in that over the past decades. So we could look at, how are we improving safety? There's a lot of talk about patient experience and patient centricity. But then again, when you speak to most patients, and most of us, unfortunately, may have been patients, lots of complaints about waiting for appointments with access, complaints about waiting for information. You hear the stories about staff, staff not being engaged, staff burning out. So those things are not excellence, at least for me. And when you compare healthcare to other high reliability organizations, we're not yet excellent. We're making progress, but we still have a lot of work to do. So that's mine.
Thank you. And I'm really glad you touched on patient safety. I think that's really also central to this conversation, and we can come back to that and unpack it a bit more later. So let's get started. Rola, you are the Chief Medical Executive in a private hospital. What do you see your specific role is in driving patient excellence? And are there any examples you can share of where you have tried to achieve excellence in your organization?
Yeah, sure. Clemenceau Medical Center's mission and vision is about providing patient care in an excellent way, in a very efficient and prompt way. This is why in our strategic goals, patient experience and excellence in care are main goals. So my role would be to align my medical team and the clinical team within those strategic goals. In order to do this, we have to work hard on establishing clinical teams first. Teams who work who are really highly ethical and highly credentialed, and who work as per the evidence-based. We do have our internal processes to monitor the implementation of the best practices when it comes to diseases, to procedures, to any other surgical procedure that we perform. Also, as a CMO, I have the duty to get the technology for those physicians, to provide them with the resources they want in order to excel in the care and provide the care for patients. At the same time, we collaborate with the operation in order to decrease the waiting times, the long waiting lists, and provide the most efficient care on time. Also, as a CMO, it's very important to measure. And if we don't measure, we don't improve. And this is a continuous process that we do. We embed the culture of performance improvement within our frontliners. So everyone speaks up about any issue that they are facing, and it is the duty of the management to provide them with improvements in order to have a better care provided to the patient. And when we say we measure, those are indicators that are measured regularly every month and submitted to the board of the hospital, so they see also it's a dual communication to see where the hospital is, what resources they need, and to provide us with what is needed. I'll give a few examples of indicators, like we measure the infection rates, the surgical infection rates, the return to the hospital, the return to the operating room. All those are indicators to tell us if we are providing a good care to our patient. And to excel in this. Moving a bit forward, we have to do the extra mile, is we can establish centers of excellence. And actually, we have done previously the JCI accreditation, which is the standards, the high standards for care. However, we can subspecialize, and I think perhaps David can talk more about the oncology, the breast center of excellence that you established. We have established the robotic center of excellence. So many examples in the field in this regard.
Thank you, and it's great to hear that it goes across the organisation, from the front line with methods to monitor and implement change. So thank you for sharing that feedback. David, coming to you. So a bit of the elephant in the room with you being on the media lately, the last couple of days, and the talk of the town in the healthcare sector. Congratulations again, by the way. So my question is, reflecting on the role that you have played in Mediclinic, an organisation, a healthcare provider that has been profitable, growing, large, complex, and the role that you're about to take on. What is your perspective on what differentiates healthcare providers who are thriving in change and delivering excellence versus some of the others?
Yeah, well, this is the first time I'm speaking publicly since I announced it last week, and I've been with Mediclinic for 30 years. So, from when I left high school. And it's a fantastic organization, and as you know, it's in Switzerland, the UK, here, and in Southern Africa, and I've worked all over. And I was very fortunate to come here in 2006, and when we bought 50% of Wellcare Hospital at that stage, and then we built City Hospital, and we did quite a few things. And it's been an incredible journey. I've really enjoyed it. It's got fantastic people. It still has fantastic people. And I think what differentiated Mediclinic at that stage was people were traveling abroad for healthcare. And that was a big focus one of the big things we focused on is how do we get people to trust the healthcare system in the UAE? And trust is a word that is used quite flippantly, but it's a very, very important word in healthcare. And it's a very important word in life. And I think what we managed to achieve at Mediclinic is we managed to create trust in not only with the regulators, but with the insurance companies, but also with the patients. And that was something we focused on right from the outset. And I think to a large degree we managed to achieve that. For me personally, doing the same thing for 13 years, it was time for a change. I love living in the UAE. This is my home now. And I didn't want to leave the region. And I just felt it was time for a change. NMC is an interesting opportunity from the standpoint that they've, from a clinical perspective, from a patient perspective, they serve a certain target market. And every day they see millions of patients across the year, and they do a fantastic job. Obviously, what happened in the media is quite unfortunate. You had people allegedly doing things that expose the company to big financial situations, and they've just come out of administration. And basically what I think NMC, the board, and the shareholders are looking for is they'd like a fairy tale ending to what has been a bit of an unfortunate story over the last few years. And for me, that sounded really interesting, is if I can in some way bring about trust back into that system, and to create a culture there that people want to work at, they want to be part of, which I think is a large part of that is already there. Then I'm really excited to be able to do that. It's really an interesting opportunity, and I know it's come within Mediclinic, my own organisation, as a bit of a shock, but it was time for me personally to do something different, and it sounded like a really interesting and exciting opportunity here within the UAE. And as I said, I'm passionate about living here, and if NMC, who is already a big provider here and is already doing a fantastic job, can extend that and expand that, then I'm looking forward to being part of that journey too.
Thank you.
Hope that answers it.
Sarah,
Yeah.
can I add something to that? Just
Sure.
in line with
Please.
what David was saying, and your question about the difference between organizations that adapt and change and pivot and the ones that don't. I've been here 15 years now and watched with Mediclinic, and it's just continued to progress and grow and be exceptional. I've been fortunate over the years to work in a lot of different organizations But normally I get called in when organizations are in trouble, or they need to improve, the things are wrong, which is probably one of the reasons that I haven't worked with David at MediClinic, because they've just been, skyrocketing. And I find kind of the same thing over and over again when I get into these organizations and I'm working with the board. And the first thing, I'll look at all of their board decks that the directors get. And it's this mountain of information that you can't make any sense of. It's too much for anyone to digest. And the way it's presented, it's confusing. And they tend to, when I compare what the board is getting and what the executives are getting as information and reporting, and then when I take a deep dive into the organization itself, all the way down to the front line, they tend to not match. Right? That there's things happening within the organization, and this isn't in all organizations, but it's in the ones that I've been exposed to that are in trouble. And these are the same organizations that tend to take forever to make decisions. Right? And I see so many people nodding their heads because we've all been in organizations where we can't make a decision. It takes forever to make a decision. Well, when you combine the fact that they have no accurate visibility to what's really going on, both within their organization as well as in the market, then there's a hesitance. Should we do this? Should we do that? They can't really take definitive action. So for me, the difference I've seen between organizations, that have consistently, quickly taken action to adapt, and the ones that take forever, and then most of the time when they do make a decision, it tends to be maybe the wrong one, then they need to retrench. And so much of it comes down to having accurate visibility into the real performance all the way down to the front line, as Dr. Rolla was saying.
Thank you. And you stole part of my next question, but I think it's really a really important point. And I just wanted to come back to David because I think trust is such an important theme, and it's so important to healthcare, but we don't talk about it often enough. So thank you for bringing that to the conversation. And you began talking, Brian, about adapting to change and touching on some of that. So I know that, we say the healthcare sector is constantly evolving, right? And we've seen that happen more so over the last few years than others, with the pandemic, with the rise in digital technology disrupting the sector. You began giving us that story, but can you tell us, how these healthcare providers can actually adapt to change whilst continuing to deliver excellence in patient care?
Sure, I can. It's probably best with an example of something that happened with me recently. As I mentioned, I get involved with hospitals that need to be fixed in certain ways. I was fortunate. I was called in to turn around a hospital in Kuwait about 2 years ago. And I arrived, landed, I was there a week, and then COVID happened. Airport was closed, couldn't see my wife, who's here. Oops, embarrassed again. And so you can imagine that being brought in for a turnaround situation at the same time a pandemic is hitting can be a bit challenging. So we had all the normal turnaround, assessing things to sort out at the same time. How do you adapt to a situation that you've never been through? I had to deal with that before. So we had to make some of the same decisions that most providers had. Do we want to be a COVID hospital or not be a COVID hospital? Do we want to offer PCR testing or not offer PCR testing? And it was challenged in that we had a new management team in place. We didn't have the visibility that I was talking about going down to the front lines. Fortunately, we had a small team of people who had worked together before, and as David was saying, trusted each other. Right, so we had worked on different things. We made a pretty much overnight judgment call to not be a COVID hospital, but instead of just doing swabbing and sending it off to someone else's lab, we decided to upgrade our lab to do our own in-house PCR testing, but not as a profit source, to use it as a loss leader, with the specific intention of, at that time, as pretty much everywhere in the world, turnaround times on results were 48 hours. And in Kuwait, the market was charging around 150, 200 dirhams, at the beginning when everyone was like, make it rain. So our plan was, we entered the market at 50% of the turnaround time, so 24 hours, and 50% of what they were charging. And every month, we just kept dropping it and dropping it and dropping it. Soon we were doing about 2,500 tests a day. And again, the intention was not to make money from the testing. You know, at the same time, I had hired a dedicated sales team that I trained to convert those, a percentage of those PCR test patients into inpatients. So within 3 months, our outpatient volumes were just going crazy. I guess having a team, even when you don't have the visibility, but that you have the experience and the trust with each other is really important. If you have an organization, a leadership team that don't trust each other to make decisions, then it's really hard to make those quick adaptations and changes.
Thank you. I'm not sure if Rollo or David, you want to add to that at all?
I think it's a great example. We've been through the same when we established CMC here in Dubai. We first opened and we got hit by COVID immediately after licensing, which was 3 months. And we also had the same experience. When you are well prepared and you have your teams, you have your processes, you are able to drive change and to accommodate with any new situation. It's about planning and implementing your contingency plans. So, and change needs really the will from the people, from the frontliner. And if you have a trust within the team, you can really implement the change.
Thank you. I think moving to another theme, which we're seeing coming up to the center of the conversation more recently, is climate change and sustainability in healthcare. We know, healthcare sector is one of the greatest contributors to emissions, and we're seeing a greater focus on this here in the UAE with the next climate change conference coming in, COP28 next year. I'm really interested to hear from you, Rola, about how we can make hospitals more sustainable and how this can actually impact patient care as well.
Indeed, ESG now is a huge topic: environment, social, and governance. We hear a lot about what we are doing as human beings to the planet and harming the planet. And I think hospitals do have a lot of improvements to do in this sector. Hospitals, they do provide a huge amount of clinical waste that might harm the planet, which is the processing of this clinical waste can produce toxins. We also use lots of fuels for our energy, for the driving all the machineries in the hospitals. And I think hospital can really participate in decreasing the carbon footprint through establishing green hospitals. Imagine a hospital is like this park full of greenery where patients can go out, can walk, and the greenery itself decreases also the amount of emission. So many examples we can do. We can process the clinical waste in a very high standards way to decrease the toxins released. We can, the water sanitation is important. The building, the construction, the structure, the infrastructure of a hospital is very important also. It can be built in a way to decrease the carbon footprint. Many hospitals across the world have shifted to use organic food for their patient and more sustainable food. For example, I think it's Cleveland Clinic, Ohio. 30% of their food is organic to their patients. The green hospital is now a topic that really every hospital should work on to have a sustainable environment in the future. And I think creating a healthy environment is part of the patient excellence in our care. So we're providing a healthy future for our future population.
So it's that broader moving from sick care to healthcare at a larger scale. David, I think you'd like to add to that?
Yeah, look, I'm quite passionate about this ESG, and we've been on this journey for quite some time. And Mediclinic has a target to be net carbon neutral by 2030, which is very ambitious. And look, the hospitals use a lot of electricity. a heck of a lot of electricity. And fortunately now in Abu Dhabi, you can buy clean energy. You can buy nuclear, and that's what we've managed to do with all of our Abu Dhabi and Al Ain facilities. And we're looking forward, inshallah, to that coming to Dubai as well. We also use a lot of gases in the theatres, and it's important we move towards closed systems and really monitor the use of gases. And as Rula said, there's a lot of waste in the hospitals. There's a lot of plastic in the hospitals. We put all of our pharmacy products in plastic bags. They come in, we've got plastic water bottles. There's lots of this that is in and around the hospitals. And a hospital in itself is a big ecosystem. City Hospital has, I think, about 1,200 staff. So there's a lot of people in there, and it's important we educate them to understand exactly what it means to become carbon neutral. Because just buying an electric car is not going to make a difference if you're still using electricity that is generated through oil or gas. It's not going to make any difference. It's actually, I think there's some theories that say it increases the carbon emissions because of the production of the batteries. So we have moved towards hybrid vehicles as well for the transportation, but that's not enough. There's a heck of a lot to do. And if we don't all do something together actively, and it's not just hospitals, it's everybody, in terms of education, understanding what the impact is, then we've got challenges coming. I know, Marwan, you like to go to Miami. Half of Florida is going to be underwater within the next 10 years. Jakarta is going to disappear. Maldives is gone. Maldives is buying up land in Australia at the moment to move their people there. This is a serious problem. And, if you look at how many countries, 60% of the world's population relies on the Himalayas. And if you take all the ice that's melting and the eventuality of what that results in, no more rivers, no more water, we have a really big problem. And we all need to start doing something about it. And it starts at home, and it moves into all of our organizations. And I think we all must take this extremely seriously.
Thank you. We don't have to look very far to realize how much we have to do. Brian, you'd like to add to that as well?
Yeah, first of all, very well said, David. I mean, very passionate as well, so I couldn't agree with you more. And so much of it, we have so many facilities that are already here, but so much can be done with the new facilities that we're designing. We have Anas here from Stantec, their organization is doing a lot of, interesting things globally. Hamdan bin Rashid Cancer Hospital that I'm doing here. When I first arrived in February, there was a certain size that it was going to be. It was very Dubai sized, right? But then when we started looking into these other concerns and as well as what really made sense, it went from being a large box of beds, all right, of a certain size to a much smaller, more campus, more sanctuary type, very green space. And then taking very much sustainability and the environment into play. So, from design, when you consider these things, we can do a lot of really interesting things. I'm doing 2 projects in Rwanda right now, and that's just a spectacular place to do things, first of all, because it's beautiful, but then also you don't have a lot of large mammoth infrastructures that you have to deal with. You have very much a blank slate, but then again, just starting from design and your founding principles of sustainability and the environment, and can allow you to do a lot. There's been so many advances in technologies and fuel sources and closed gas systems. So a lot of challenges, and it's important that we all really are passionate and take action on it.
Thank you, Brian. And I might stay with you and bring us back down to the patients. And there's something, you started speaking about at the beginning, which is patient safety, errors, and I'd like us to talk about that a little bit more. We know that there are patient errors that occur in hospitals globally. It's an issue we're aware of. From your perspective, what is some of the root causes of this? And what are the systems or the platforms that you've put into place or know of that stop this from reaching the patients or impacting patients?
Yeah, I'm pausing because it's such an important question and such a big question, and we have all the patient safety conferences and all the posters on the walls and everything, but every report that I read, and when I say we, I mean globally. And this isn't a UAE thing, that we're not making much progress. And the more they dig, the more they find out that ever since To Err Is Human was published 3 decades ago, that there hasn't been a lot of progress. And what I found in my experience is going to the root causes I believe are grounded in processes, the lack of processes, the lack of standardization and communication. When you think about something as complex as a hospital or a healthcare organization, there are literally tens of thousands of different processes and workflows, going on there, and we're not very process literate as a sector. If you look at process literacy, understanding business process management and things in other high reliability organizations, whether it's airlines or nuclear energy or whatever, they have it down. But when you go into hospitals, it's kind of an afterthought, and they may or do a couple of Kaizen events and whatever, but it's not really part of the culture. So that's why whenever I either go into an organization to fix it or go work somewhere, one of the first things I set up is a business process management office staffed with a bunch of industrial engineers. And this first happened with me here in the UAE when I was working at Tawam Hospital 15 years ago now. And one of my first hires, because I was brought in there with Hopkins to improve things at Tawam, and one of my first hires was this wonderful woman, Sarah, who's an industrial engineer. And she was supposed to show up for work on Sunday, and Sunday came, and Monday came, and Tuesday came. And I asked Rashani, my person working with me, where's Sarah? And I said, she's supposed to start working. So she said, she started working on Sunday. And I said, well, where is she? She's down in the basement with the facilities people, because I hired an engineer, so they assumed that she was going to be doing maintenance and stuff. So then when I brought her up, and after a few months of sending her around doing process mapping and doing all these things, finally they started getting it, and the benefits of that in all areas, whether it's safety or cost reduction or increasing revenues, we could take the whole weekend. And just as a point, like a side note to that, Mayo Clinic, U.S., which is arguably a pretty good place, they employ over 200 industrial engineers for specifically this purpose. They consider it their secret sauce to their success is having a team of industrial engineers that are constantly revisiting every single process across the organization. And then second to that, but also equal is communication. Going back to what I was saying earlier about trusting and communication, that when we look at the reporting, when we look at what we hear about the safety in our organizations, everything's great, right? You look at the reports, it's all the little green, we're really doing really terrific. But then if you look at really where your information's coming from regarding patient safety, you're going to get it from maybe three main sources: the doctors, the nurses, or the patients, right? And in different cultures, and I mean organizational and country cultures, not if you're in Europe or the UK or in the US, you'll get much more outspoken about sentinel events and near misses. Unfortunately, it's still the case here where well, this is a global thing, from the doctors, sorry, Dr. Abdelghani, but they won't tell you anything, right? I mean, everything's always good. There's no mistakes, so you're not going to get any of your near misses and things from them. A little bit. Patients, well, they're afraid to really let you know things because they're afraid it's going to impact the care that they're getting. So they're sometimes hesitant to say things. So you really have to rely on the nurses, right? They're the ones where you're going to get most of your patient safety related information. However, the challenge, and this is specifically for the region here, is the nurses are afraid, right? There is we don't like to openly talk about this, but I talk with a lot of nurses, and there's generally a culture of fear, right? Where they're afraid of the doctors, they're afraid of losing their job, they're afraid of getting, of the patients, their landlords and all. So when you see these reports where, the near misses and everything are very, very low, abnormally low, lower than anywhere else in the world, it's because they're just not being reported on. So, one of the main things that we all need to work on, and I spend a lot of time on it, is helping them feel safe and building that culture of trust is, I think, one of the most important things is building that safe, trustful environment for the nurses specifically, and then being process literate.
Thank you. I think that theme of trust still coming through as well, and it makes me think about the systems that you're talking about. Do you want to add to that as well, Rola? Please.
I just wanted to add something that we do a bit differently at CMC. We do not employ engineers to do this for us. We teach every single employee how to do it himself. So we build like teams in different departments, and whenever we have an incident, we all meet together and we design the process, we write it down, and we look at the failures, where did the failures happen, and we redesign the process again without those gaps and those failures, and we teach, and train people. It's very important. We have in Dubai in general, there's a high turnover rate of staff, and it's very important to maintain the education and the training within the organization. And a safety culture is based also on learning from our mistakes. So what we do daily safety huddles. We visit patients in their rooms. We ask patients about the care. We ask staff about any incident that happened with them, and we encourage them to speak up. And also they can use it as a teaching material in front of a group where they speak up about this and the ways how to, we use them to give us ideas about the ways how to improve the care and how to correct those errors. And most of the time, it's a system problem. It's something within our systems that we need to fix for the frontliner to be safe when they are executing their mission.
It's great to hear those different perspectives, and I think different systems makes me think about how we can or have leveraged technology or digital health solutions to help us solve or help us create efficiencies or platforms. And I know David Mediclinic has been one of the organisations that's been early adopters, I think, in some of the digital health and technology solutions. So if you could share with us how you have leveraged maybe some of the technology to adapt to change and deliver excellence in patient care?
I agree with what both Brian and Rollo are saying here. I think the reality in healthcare today is it's still very people-driven. And, you know, as soon as you've got something that is people-driven, people will make mistakes. No matter how many times you train them, you know, we all have different moods. We maybe had 3 cups of coffee instead of 2, or whatever the case may be. So things will happen. And, you know, we put in systems to measure, you know, patient falls or whatever the case. We have all these measurements. And normally we align incentives to those measurements, which then results in people gaming the system. And, you know, a whole thing happens behind that. So it's quite important that we're able to bring in technologies to be able to prevent, you know, care going wrong. And we're still very, very much in the early stages of this at this, you know, this point in the healthcare journey. There's no standard approach to healthcare. The Americans train their doctors one way, the Brits train them somewhere else. In Australia, they train them in a different way. So there's no standard way of doing things. Whereas airlines, they all have to operate under the IATA, you know, umbrella. There's even different accreditation bodies. You can go for ISO, you can go for CAP, you can go for JCIA. It's just a big business out there in terms of all these different accreditation bodies. So we need to get healthcare, we need to disrupt healthcare with technology that is able to be able to take all these different training schools and to create a standard way of approaching things, because only then can you use your industrial engineers and the likes to be able to improve those processes to deliver better patient care. I think having a standard EHR is a given. It has to be in place, and you will not believe it, but even within my own company, within Mediclinic, we only have a standard EHR in Mediclinic Middle East. We've got 54 hospitals in Southern Africa. We're still rolling it out. In Switzerland, which is probably one of the best healthcare systems in the world, we don't have one. It's still paper-based. So it's very difficult to bring technologies into those systems when they're still using paper. And we've rolled out the EHR now across the division here in the Middle East. And what I can say is we now have data. And from that data, you're able to use AI, you're able to introduce benchmarking, best practices, and you'll be able to improve care. We're moving towards precision medicine. So once you map the genome, you can then take that genome, integrate it into the EHR. It's impossible to give a doctor and say to him, here's an 800-page document on David, now treat him. This needs to be integrated into a system that flags the doctor to say, listen, don't give David this pill. It doesn't work with this. He's got this problem. And so we're now moving into this era where you're going to have the DNA that's mapped, you're going to be having the microbiome, you're going to be doing metabolomics, proteomics, pharmacogenomics, all the genomics. It's all going to be integrated. And how do you use that data to inform better patient care, to inform the doctor on what to do? So it needs to be integrated into a system that then flags the doctor to be able to treat the patient better. And obviously we've got technologies like cameras. Cameras are evolving so much so that you can do facial recognition at the airport. You can do all sorts. It can also be a flag system in the hospitals to understand, are nurses stressed today? Is that nurse under a lot of stress? What is the likelihood she's going to make a mistake today? Because the camera is telling you, David looks really angry today. We better go and say hello to him. And it can also stop patient falls. It can alert you beforehand that the patient is, has moved his bedside, thing, he's going to get out of the bed. So there's a lot of these technologies that are out there that we can adopt in healthcare, and we're only just getting started. One of the key challenges is obviously data sharing, because people always click, don't share my data. I mean, that's actually the worst thing you can do in healthcare, because we need to take all that data to be able to generate enough information that we can create better systems and better improve the processes. So we've adopted quite a few technologies, but we're still, if I'm brutally honest, in our infancy. We've adopted an EHR, we have an online patient booking system, we obviously have telemedicine, we can have pharmacy home deliveries. We're busy with a virtual ICU project, which is really interesting. There's so many different things we're busy with, but I think the message is we are still in our infancy, and conferences like this and technology companies that are out there know that there's a huge opportunity, and I'm looking forward to seeing what's around the next corner.
Thanks, David. And I think, mentioning sensor technology like cameras being so integral and so centre to digital health and the impact that they can have. And it was really great to hear you say that Middle East has been the first to digitise, and it's another example of where we lead globally sometimes in the digitization of healthcare, at least.
You know why that is because we don't have legacy systems.
Yes.
So we're able to leapfrog, legacy systems. It's quite difficult implementing an EHR when you've got, in Switzerland, 6,000 doctors, and they're all used to using, paper, and you've now got to get them to understand and to utilize a computer. They see it as interfering with their practices, and it slows them down. They're going to earn less money, all of these sort of things. So it's quite tricky to introduce these various technologies. I'm busy piloting an app at the moment. It's not yet out there, that if I look at it, it scans my face, and then it tells me what my blood pressure is, what my weight is, what my heart rate is, what my age is versus my real age. I think it gets it wrong quite often. But it's quite an interesting app. Now, I'm not saying it's accurate yet, because otherwise it would be mainstream. But this is where we're going. This is what you're going to be able to do with this information.
I think we could have an entire session on this.
Yeah.
Sorry, Rolly, did you want to add?
No, I just wanted to tell David, for Switzerland, you just recruit junior doctors. They will do the work for you and implement electronic medical records, and they are really very good at it. Doctors who have trained in the States the last 10 years, they are all electronic, and they just change the culture of the organization. I've implemented twice electronic medical records in 2 institutions. The first one was really very hectic because it was 20 years ago. However, the last 3 years ago, it was so smooth because the doctors are joining are younger. They know more in electronics.
Yeah, just one thing on implementing the EHRs. When I was at TWAM 15 years ago, that was the first implementation of the Cerner, right? Great technology, great people training and everything. But that's when it really became crystal clear to me, going back to the whole process thing. Because all of the reworks, the expensive, the hundreds of millions that we ended up spending in all the reworks, because, when you think about, any kind of a technology platform, electronic health record, it's kind of a flexible matrix structure. It's not firm, rigid. You can adapt it somewhat, but it's also not do whatever you want with it. But then when you look at the organization, and there's, as I mentioned, the thousands of processes and workflows, and then it depends on who's at work when, and as David was mentioning, all the different ways that people do things. So you have not just a lot of processes, but processes and workflows that behave differently depending on who's on deck, and you try to overlay this matrix structure on top of this bucket of worms, all right? And you end up with 70% of IT initiatives failing, and I think that's one of the main causes is this very fluid operating environment that needs to be more standardized and process-driven that will then allow us to be more successful on these sort of implementations.
I think we're going to definitely have to come back and talk about digital health in a session on its own. But I know everyone's going to want to ask questions. So one last question to all of the panelists, and it sort of brings us back to the start now. Looking forward, what do you think are the essential considerations in driving greater excellence in patient care?
I'll talk only about creating excellent teams. So excellent clinical teams and with the support of the management and the leadership will lead to excellence in patient care.
Yeah, I think I said earlier, trust for me is the key building block of a healthcare system. If patients can trust you, if regulators can trust you, if payers can trust you, and if you have trust within your organization, between your employees and the management, you talked about people being afraid to speak up, that's the only way we're going to improve, and the only way we're going to listen to each other to be able to improve the quality of patient care, and obviously listening to patients and continuously learning from that. I think there's a long way to go in terms of healthcare. I think we've actually come a long way. If you look at, throughout history, 99% of history, the life expectancy was 24 years. Now we're sitting at a life expectancy of bordering on 80, and I believe my son, who was born in the 2000s, will probably live to beyond 100. That'll be the life expectancy. So we are improving, but there's still a long way to go. And I just think that trust is the key building block to all organizations, but specifically healthcare, right the way.
Terrific. I'd like to focus on the innovation part of the excellence, because that's something we talk about, we hear about a lot, being innovative, and we all need to do that. And David mentioned all the omics and the AI and all the different, there are a lot of fantastic and proven technologies and service models out there. However, they're not making their way into practice. And some of them are, but when you see all the things on LinkedIn and all the great things that are happening, it's like, well, how come we're not doing it? Because there is so much. And a reality of this is, these things will not be put, once they're proven and tested and trialed and all that, they won't make it into practice unless their use is reimbursed for. And they're not going to be reimbursed for unless the regulator has approved them. So in order for us to embrace a lot of these proven technologies, I believe it's super important that the providers and the payers and the regulators, that we start building a very close and continual partnership, collaboration, where instead of fighting against each other, that we're actually working together to find pathways to bring some of these proven and very effective innovations into practice. And it doesn't have to just be advanced AI models, even all the aspects of advanced care at home that could be done, but it's not yet being done. And this isn't just here, this is globally, simply because payers aren't reimbursing for certain things, and they're not reimbursing because the regulator has approved it. Going back to Mayo quickly, because I've done a lot of work with them, they have a great advanced care in the home program, and for their systemic therapies, they're currently providing about 5% of all their systemic therapies in the home. And I said, well, is that the most that you could do? And their first response was, yes, that's the most we can do. I said, well, clinically and safely and all? They said, no, that's what we get reimbursed for. I said, so as a percentage of all the systemic therapies that, for your cancer patients, what do you think it could be? And they said, oh, it could easily be 25% could be provided in the home if we got reimbursed for it. But the FDA hasn't yet approved it, so really, if we can, maybe Marwan, this is something you can spearhead, putting together a program with some payers and regulators and providers to have that discussion, how we can work together to bring innovation in to foster excellence.
I just want to add a small comment on innovation. We have to be very, very careful which innovation to adopt in hospital setups. Many innovation, many applications are valid for healthy people. However, when it comes for sick people, we have to be careful what to use on our patients, and it has to be FDA approved, reimbursed, as well as safe for our patients.
Thank you to all the panelists for your insights. Please join me in thanking the panel for joining us today.